Thank you, thank you, thank you. Here we go. Good morning. How are you doing? How are you doing? Really? Come up. Okay. How are you doing? Okay, now that's much better. And it's a real honor to be here today and a privilege. And for those of us who knew Sheila, I think this is yet another very special time to remember her. So here we are. Please get the app, because the more we interact, the better. The hope is to have an intellectual jazz performance that we are going to co-create today. So the more we interact, the better. Please make my life difficult. The idea is that you express whatever you feel on the app, so we can all get to see what we are generating. And my deal will be to try to involve in my presentation your perceptions, your suggestions, your answers. So together we can build a unique experience. Yeah. Great, thank you. How are you doing? There you go, doing well. This is what's going to be happening there, and it's anonymous. So feel free to express whatever you want, and good morning. Yeah? And see what may happen if we decided to become, Are there any dog people here? We need to promote some equity here today. And so this is beautiful already, okay? So hang in there, please, keep doing it. Thank you, dog people. Any horse people here? And that person who is called, if you don't mind identifying yourself. Okay, so Rich, Ryan, could you give him a hug or do something for him? Okay, thank you very much. So we are going, this is good already. So the topic is bringing back health and the public into public health. And so this is the animal sounds feed now. Do it, enjoy it. Life is too short. Yeah? And the hope is that by the end of my presentation, we'll have a conversation, not just with me, but with each other. Okay, so let's see if we can pull it off. Let's see if we can pull it off. There are many people who are attributed, to whom a lot of things are attributed, and Albert Einstein is one of them. And apparently he said at some point when somebody asked him, what would you do if you had 1 hour to solve a problem? And if you don't solve it, you would die. He said, I would spend the first 55 minutes of that hour trying to figure out what is the right question. Because once I get the question clear, I can solve any problem in 5 minutes. Okay? So I want to invite us to slow down a little bit, to be urgently patient, because we are going through very interesting times, okay, as a species. We might be at risk of extinction. And public health has more and more a very important role to play in trying to shift the way in which we as a species are developing. So let's pause for a moment. Yeah? Let's pause for a moment and see how would we answer this question. What is the essential question for public health? What is the question? Phones down, and if you put them on vibration on a place where it would tickle you and make you happy, even better. This is e-health as well, public e-health. Okay, what is the essential question? What is the question that would make us in public health say we have done our job? We are not needed anymore. That's not a question, that's 2 words, climate change. So try to formulate it as a question. That's an issue. Buenos días. Great, thank you. And it will get better if some of you get tickled in a different way, intellectually. Yes, how can we improve health for all? Is it enough to improve health for all? Can we achieve equity? Ideally with a question mark. How do we stop global warming? Yeah, let's try to work ourselves out of a job. Even if we stopped global warming, would we work ourselves out of a job? Is that enough to stop global warming? Even if we did more with less, would public health be still needed? What's health? Now we are going deeper. How do we reach priority populations? How can we promote species survival, our own and others? I mean, this is getting pretty deep here. This is the kind of conversations we must have. Is everyone experiencing optimal health? How do we change our culture? What kind of culture do we have that we need to change it? How do we make healthy the default setting? What is optimal health? Can we even agree on the essential questions? Do you think we could agree on the essential question based on what is starting to emerge there? Show me your hands, please. If you think we could agree on one question as the essential one for public health, hands up if you think we can agree on one. Okay, hands up if you don't think we can agree on one. Okay. For those of you who are watching this right now live or later on at a different time, different place, about 90% of people here thought that we cannot agree on a single essential question. Very interesting. How many of you are not sure? How many of you don't care? Okay. About 90%. Can we make health better for the population and not just the individual? How can we promote good health rather than fix bad health? I think there are lots of converging ideas here. How do we ensure a healthy planet for our children and our children's, I imagine, children? Yeah. So I took a bet. I bet on one that is very much focused on the next generation. And I would like to introduce you to Gabriela del Mar, our first granddaughter. I delivered her, and I delivered both of our kids. My grandfather, who was an obstetrician, delivered my mother and delivered me. So I'm now grandpa, delivering grandchildren. And quite an interesting experience, I can tell you. So, and we didn't plan to have the same shirt, by the way. It was coincidental. And I couldn't resist when that picture was taken. So I just went on top, and we had a great photographer who, I think, captured love there. What kind of world are we going to present to Gabriela del Mar and her cohort? What will be the contribution of public health? And so thinking about this, I came up with one which I think involves a lot of the comments, a lot of the questions, a lot of the elements that were generated a few seconds ago. How could we enable everyone, not just the individual, everyone, 7.5 billion people now, 9 billion very soon, okay, to have a life perceived as healthy, ideally until the last breath. as part of a sustainable, thriving, flourishing planet. And I would like to propose this or a variation of this based on what is emerging through the text as an essential question from public health. And what if we in Ontario decided to propose a question as the essential one for public health worldwide? And what if we called upon the world and said, let's join forces to try to answer this question together and to work ourselves out of a job? What if we did that? What if this could be one of the outcomes of this year's convention? Let's challenge the world to focus more on health and to consider disease as an important issue when it is a barrier to health. Because I think we are still very much focused on disease, to the point that public health could be called more appropriately public disease. Okay? When we enable, does it mean we accept that some people will choose to behave in ways that will make them unhealthy? We don't know. We don't know, but I want to show you some data today, after we experiment a little bit. So, how healthy are we? What would happen if we started with ourselves? How healthy are we? This is not a rhetorical we. This is an actual we. How healthy are we? How much of a role model are we for society? We're talking about equity there and enabling. How enabling are we? How equitable are we? Yeah. How could we become a good example that others could follow? And I wonder if we have data about ourselves. Have we ever attempted to judge how healthy we are or not? Yeah. Any hands up if you know of any studies on the health status of public health professionals and staff in Ontario? Raise your hands. Yum, yum, yum. This is Professor Alex here, feeling tickled. How about doing it? Second challenge for the day. Would we be able to do the first study probably in the world? I have a PhD on systematic reviews, and I tried to find data on the health status of public health professionals. Couldn't find one. If you know of one, please let me know. And by the way, there are 3 microphones here, and if you feel embarrassed about making a comment, not even by the app, put it on a piece of paper and bring it here. My wife would be delighted to give it to me. 36 years together. And Martha, she's somewhere here probably taking pictures and making sure I am safe here. So, how about doing a study of how healthy we are? Would you like to participate in that study? Raise your hand if you think it's something we should do. Raise your hand if you think yes. Raise your hand if you don't think we should do such a study about the health of public health professionals in Ontario. Raise your hand if you're not sure. Okay, a few hands up, very few. Raise your hand if you don't care. Okay, now we are about 40% response rate. Okay? You gave me about 90% response rate before. Okay. Public health experts are stressed, overworked, forever optimistic. There are market forces that challenge our efforts to be healthy. Isn't this interesting? What are those market forces? Could we make those market forces that may be invisible formally more visible? And are those market forces also hindering the ability of the public to consider themselves healthy? And if we are on the same boat, could we address those market forces together with the public so we could enjoy a healthy life until our last breath? So this is a challenge that I would like to try to meet together. And if anybody here is interested in doing it, please let me know. What if we assessed our levels of health and we try to understand how close we are to the ideal we wanted to set for the world? But somebody said, what is health after all? So what is health? What do we mean by health? What is health? We are here at the Ontario Public Health Convention. We work in public health. What do we mean by that word? We don't spend enough time thinking about the very construct that justifies our very existence, at least from a work perspective. So what's health? Not just the absence of disease. And in 1948, the World Health Organization defined it. It's right at the top of the Constitution. Health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. A state of physical and mental well-being. Then why don't we call it well-being? And if it is not just the absence of disease, is it possible for some people who don't have diseases to consider themselves not healthy? Okay. And what if we age and we develop diseases? Are we condemned then not to be healthy? Yeah. Perhaps we need to accept that we cannot agree upon a standard definition. And Wittgenstein, the philosopher, would have agreed with this. He said that we cannot even define the chair. Try to define the chair. A chair. Something to sit on. Dan is saying, is this a chair? If I sat on your lap, would you become a chair? You see, everything we try in terms of even defining a chair will show us how limited words are to capture concepts, even of a day, an object we use every day. Yeah. Feeling good, healthy bodies, healthy mind, healthy environment. But as a group, we are more advantaged than most. Why study those who systematically have so many benefits? I don't know. 90%, well, not 90%, about 40% of us said it was a good idea to have the study. And who said we are healthier than the general population? That because we are privileged in this way, in whatever way we perceive our privilege, we might be healthier. Yeah. So you look out, First Nations Health Authority calls public health community well-being. Then why don't we call it community well-being? Why use a double set of terms? If it is community well-being, it's community well-being. And who is to decide that? Because then we might need to consider this to be the Ontario Public Community Well-being Convention. If we agree that that's what we should be doing. Okay. I have drawn your box. We have a philosopher in the room. This is great. The chair you want, I didn't say I wanted a chair, by the way. I said, can we define the chair? And that was a challenge that Wittgenstein gave to us. But that's nice. If you want, it's inside that box. This is very interesting. Tell us more. Who would like to hear more about this box? Okay, so there is something called the tacit dimension. And Michael Polanyi wrote a book entitled The Tacit Dimension, which basically reflects the gap between what we feel and what we know and what we can express with words. Some other people call it the knowledge gap. We know more than we can tell. We feel more, this is my version, than we can tell. So let's see if we can capture this tacit dimension. So let's experiment a little. Because even if we don't do the study today, we will get some insights as to how healthy we are. Are you game? Should we experiment a little? Are you sure? Yeah. Come on. Okay. Are you ready? Yeah. Okay. So now, you can see two groups there. There is one with a woman with a white hair. Those are you here. Please follow that woman from the middle, from the camera, to that side. Okay? Those of you who can see the other group would follow the man with the white hair and the white shirt on the top. Okay? So let's go for this. For this side, raise your hand if you have complete physical, mental, and social well-being. Raise your hand. Okay, show me. Okay. There are 2 people, 3 people, okay, 4 people. You are wearing glasses. You don't take your glasses off. You will not have complete physical. You are using a prosthesis. You are the patient of an ophthalmologist, okay? And if the 3 of other you who raise your hands, you have glasses too, out. So there are only 2 left. You are the patients of optometrists and physicians, ophthalmologists. Okay? You don't have complete physical well-being. And the other 2, I am a physician, so if you give me 5 minutes, I would find something wrong with you. Because for us physicians, health is a state of incomplete diagnosis. Okay. So now, let's see how this group behaves. Please raise your hand if you consider your health in general to be good, very good, or excellent. Raise your hand. Wow, good, very good, or excellent. Okay. What's wrong here? Most people are healthy on this side, and most of you are not healthy. Okay, how many of you think that your health is poor or fair? Raise your hand, please. You have twice the mortality rate of your peers, so we need to pay attention to you too. Really, if your health is perceived by you as poor or fair, there are meta-analyses on this that show that your mortality is twice as high as those of your peers in this room. So we need to pay attention to the 2 of you. And really, this is an emergency. For me, this is as close to an emergency as we can have. But when we start digging the reasons why you may not feel that your health is good, very good, or excellent, what we discovered most of the time is that the reasons are not medical. Is we are worried about a high level of whatever, I'm not exercising enough, okay? And they may be medical. Yeah. Thank you, I like you too. So now let's see. To this side, raise your hand if you perceive your health to be good, very good, or excellent. Wow, you're healthy, but not according to the WHO definition. 1948, we as the world, United Nations, representatives of all the members countries, decided to define health as a state of complete physical, mental, and social well-being. We haven't changed that definition yet. We even call it a definition when we know we cannot define things. And we condemn humanity to be not healthy. But when we as people, most of us would say that we are healthy. How many of you, raise your hands if you perceive your health to be poor or fair? Okay? 1, 2, 3, 4 hands. And really, it would be wonderful to try to understand why. And we are now starting to work with some groups to try to understand how some people perceive their health and why as poor or fair, to see if we could do something about it. And when I say we, it's a team effort. How can we enable you who perceive your health now as poor or fair to be good, very good, or excellent? Because just by shifting that, we may be increasing not only your perception of how healthy you are, but many other things. Because when we look at this seemingly trivial indicator, self-reported health, and there are many studies on this, we are discovering more and more that it's an incredibly powerful variable that we have neglected. It's at the top of most of the quality of life questionnaires, but we ignore it. We go for disability indicators, we go for many other things. So now let's see what happens with you folks. You were very healthy about 3 minutes ago. So raise your hand if you have complete physical, mental, and social well-being. Okay. This is what we have done as establishment. Okay. We set an impossible goal, health as a state of complete physical, mental, and social well-being, and not just the absence of disease. And then we wonder why public health is not as prominent as clinical medicine. Okay. So raise your hand if you feel healthy, if you think you're healthy. There you go. Most of us, 95% I would say of us. How can we enable the rest to feel like we do? Okay. What is the situation for Ontarians? Do we know, if we ask people in Ontario, what proportion would consider themselves to be healthy? Because if our goal is that everybody, 100% of the population, perceive themselves to be healthy, it would be wonderful to have data. Okay. Don't we all have 100% risk of mortality? Sure. And we tend to forget it, by the way. People in Ontario are not dying well. 80% of us would like to die at home. 80% of us might be dying in hospitals or in places other than our homes. Okay. Palliative care services, not sufficient to meet the needs of the entire population. Okay. And one of our goals at the Institute for Global Health Equity and Innovation at the University of Toronto is to promote good deaths too. So we have a project called the Good Death Initiative. So if any of you is interested in that, we are trying to figure out if there are minimum criteria that every human being should find at the end of life to consider their death to be good. We don't have an answer for that. Healthy or in denial? This is a very interesting thing. We don't know. We don't know. But what we know is that the WHO definition doesn't work. It condemns us all to be ill. And if I had to pick who to believe in terms of determining the health status of a person or a community, I would go for the person or the community. I would not rely on me or my kind. Okay. So, we spent 3 years engaged in a global conversation supported by the British Medical Journal. And we asked the question, what is health? What do we mean by health? Okay. And even though we told the British Medical Journal that we were not producing a definition, look at what they put on the cover. It's the previous one. Health. Time for a new definition. Okay. But we are very grateful to what Fiona Godley and her team at the BMJ did. They decided to do something about this. And from here, from Ontario, we coordinated this global conversation on what we as a species mean by health. And this is a statement which is not a definition, but a conceptualization. You see, a conceptualization is an imperfect attempt to translate into words ideas and feelings, acknowledging that we cannot do it perfectly. and in a way that would satisfy everybody, because these things are dynamic, they depend on perspectives, and so on. So this is what we have been proposing since 2011, to consider health as the capacity, the ability that we as individuals or communities have to adapt and to self-manage when we face physical, mental, or social challenges. And the conversation is still open. This article on the BMJ has the comments section open, and if not, send me a note. This is an ongoing process. But you can see we remove the word complete. We remove the word disease, and focus on something that has a lot to do with resilience, with expectations of life, that is much more dynamic. Is it the point not to be as healthy as we can be to optimize our health? It may be different for different people, okay? Most likely. But unless we make an effort to establish that communication, we will not know. So this is my third challenge and invitation for the day, is to engage with the public in a conversation about what we mean by health, what should be our expectations, what should we work together towards in terms of achieving a common goal. If you can only poorly adapt, then are you still healthy? I don't know. It depends on you. And what we have is a plea to ask people and to believe them. Are you healthy? Yes, but how come you have 5 chronic diseases? I feel healthy. Our reaction should be not, who are you to judge your own health, okay? But how can we contribute to your continuing to feel healthy? And by the way, there is this issue here, how can we manage it together, at the individual or at the community level? So we all now have the opportunity to have a healthy life, and I will try to prove that to you. So first of all, and before I go there, I want to coin and to introduce a concept here, which I think captures the success of public health, which is a pandemic of health. We tend to focus on the negative pandemics. Will Zika become a pandemic? Okay? Should we declare a pandemic with Ebola, with obesity, with diabetes? What if we focused on the positive more than on the negative? What if together we decided to make sure that 100% of people felt healthy? And pandemic, that's what a pandemic is. Pan all demos people. Something that affects all people is a pandemic. And what if we decided to co-create that pandemic? And when I say co-create, it's with the public, together. What could each of us do to ensure that we get to 100%? And in this room, we are at about 90%. What could we do for that 10% or with that 10% of us who didn't consider their health to be good, very good, or excellent? 10%. How many of you have chronic diseases, by the way? And raise your hand saying that your health is good, very good, or excellent. Raise your hand, okay? There you go. About 30% of people here. And even though you know you have chronic diseases, you raised your hand and said, my health is good, very good, or excellent. Isn't that beautiful? Why? How could a person with one or more chronic conditions perceive his or her health to be good, very good, or excellent? Wouldn't that be a true determinant of health? Because we don't even have social determinants of health. When we look at them, there are social determinants of the reduction in the prevalence of diseases, because our outcomes are diseases. More educated people have lower prevalence of diabetes, cancer, heart disease, fill the blank. But have we gone through the exercise to see, more educated people are more likely to perceive themselves healthier? Now we would be talking about social determinants of health, not of the reduction in the prevalence of disease. And then we could start talking about public health. Because so far we have been talking about public disease. Because our outcome has not been health, has been disease related. So I'm a professor of public disease. I'm a disease professional. Please don't turn up the heat. The room will heat up as more people join us. We might need to hug more. Okay? I'm a Colombian, I'm a hugger. Okay? And if you like this at the end, I would welcome hugs gladly. So we decided to go through the Canadian Community Health Survey, which includes the question, how do you perceive your health? Is it poor, fair, good, very good, or excellent? The same question. So in Ontario, 20,000, almost 20,000, 21,000 people were asked this question, okay, in the last version of the survey. And boom, look at this. 85.7% of people in Ontario said my health is good, very good, or excellent. People over the age of 12 who could be reached by a landline phone at the time when the computer dialed their phones. Okay, I'm identifying the threats to validity here. 31% of people in Ontario probably don't have a landline phone. How many of you don't have a landline phone? There you go. So we need to talk to the people at the Canadian Community Health Survey and say, probably your CATI is not the best way to generate data. 50% of people, at least on this side, there is a systematic difference, I think, between the two. I'm going to move to this side here a little bit and see. Okay. But about 30% of Canadians don't have a landline phone, and we are basing the Canadian Community Health Survey on dialing people like in the 90s or 80s, okay? Using a computer for landlines. So these are some of the limitations, but we need to be very grateful. 65,000 people are included every year in this survey, and as far as we know, the data since 2000 have not been analyzed collectively in terms of self-reported health as the main variable. So now we have a team of volunteers working on it. So anybody here interested in that, please let us know, because we may have about 1 million data points that nobody in the world has. Okay. Just from Ontario. So if 85.7% of Ontarians, ages 12 or older, who were reached by a computer through their landline phones, said that their health is good, very good, or excellent, what's going on here? Have we asked them? Are we going to ask them ever why they don't consider their health to be good, very good, or excellent? This could be the most important piece of information from the survey. If you don't feel that your health is good, very good, or excellent, why? And then what could we do about it? Is there any line where they should call, or email address, or WhatsApp, or Facebook, or Twitter, or whatever? Let us know, because you have twice the mortality rate as the rest. That would be public health for me. And to ask these 85.7% of people, how can we enable you to continue feeling that your health is good, very good, or excellent until your last breath? And here we are in Ontario, trying to lead by example. Okay? And imagine the lease of life that this would give us in terms of the political landscape that we all know is shifting here, okay? And the pendulum swinging more and more and more away from public health. Okay? Yeah, I refuse to go back to landlines too. Okay? All problems are a mismatch between expectation and reality. My question is that a crazy expectation? That we pay attention to that 14.3% of the population and try to understand what is happening there to see if we can be of value to them. And if we looked at the 85.7% of people and try to pay more attention to see how can we together enable them to stay like that. You are right. This is why the title of this presentation is Bringing Back Health and the Public into Public Health. The only way in which we could pull this off and realize the dream of public health is by working together. And by starting to speak in first person. It's not the public. We are the public, for God's sake, as well. And we might be able to pull it together. So let me show you some more data, and I did it myself on a very univariate way because there were some technical glitches to download some of the data. We have a team working on this. Good news on the gender front, at least from people ages 12 and onwards who were reachable by computer through the landline phones. Almost identical for men and women. This is something to celebrate. And I will show you data that would back up why we need to celebrate this so much. Why do we have gender equity in Ontario in terms of self-perceived health? You see? In a world that is rife with gender inequities, screwing women time and time and time and time again. To be a woman is not a good thing in the world. And it's not getting better. Why do we have gender equity in Ontario in terms of self-perceived health? That's a very important finding. Youth, of course, seems to help. Okay? The very early group, almost 100% of our kids, 12 to 14, who were reached by landlines, by a computer, okay, said that the health was good, very good, or excellent. Almost 100%. Could we start there? What's happening with those kids who said that their health is not good, very good, or excellent? And this is a tiny fraction. Wow, we would be the first community in the world saying that our early teenagers are healthy. A pandemic of health amongst our teenagers, early teenage. Wow. Tiny fraction. Okay. Now, I put that question mark there, and if you cannot see that question mark, it's right at the end, because after 70, our self-perceived health does this. Why? And why? About 40% of our old folks, even 80 or older, continue to perceive their health to be good, very good, or excellent. What's happening to them that we would like to understand a bit better to support it so they continue to be feeling that well, but that we can infect the rest, the 60% or so of people age 80 or older who feel that their health is poor or fair. Because that 40% shows it's possible. And we have data from other surveys in Canada and in other countries showing that the majority of people over the age of 65, even with 3 or more chronic conditions, consider themselves healthy. 2/3 of people with terminal cancer, when we ask people who have cancer, which is terminal, they know the cancer is going to kill them. And you ask them, let me know in general whether your health is poor, fair, good, very good, or excellent. 2/3, 63% say my health is good, very good, or excellent. Why? Okay? And what could we do about it? Because those people are telling us it is possible to be healthy even in the presence of disease. Is the message fundamentally the glass half full? Do you have a glass of water there? Could you please fill it up halfway through with water? Yeah, and I did this before. Rich, thank you. Richard, ladies and gentlemen, again, thank you very much. Musician, scientist. Okay. And I did this at the summit. We had a summit at the University of Toronto about the pandemic of health. This is a glass that could be regarded half full or half empty or full. It's full of water and air. You see, we tend to take sides. The glass is full of both water and air. Why couldn't we look at abundance? And we have an abundance of data, an abundance of evidence suggesting that most people, even those who have no jobs or very low income, consider themselves healthy. Look at the beginning of that graph. These are data from Ontario 2014. Even most unemployed people, close to 70%, are making less than $20,000 a year. When they are asked, how would you regard your health? They said good, very good, or excellent. Why? Yeah. I agree. That's the invitation, to focus on our perception of our own health and to demand to be respected. Who are you, doctor, to tell me I'm not healthy if I feel healthy? Oh, but look at your sugar levels and look at your weight. Yes, I know. Let's make sure those things don't interfere with the feeling I have now. So let's work together to ensure that we reduce those levels of sugar, or I control my weight, but now I feel healthy. Don't medicalize my life, for God's sake. Let's not medicalize, and that's from the clinical side, let's not medicalize our lives from the public health perspective. That's the biggest tragedy, that we are contributing to the problem by focusing on the disease when we are missing a humongous opportunity to celebrate health, to celebrate life, and to position ourselves at the heart of public attention. This is more important than having hospitals and intensive care units and antibiotics and no waiting times and all that stuff, which is important, but not more important than the dream of 100% of Ontarians feeling healthy until the last breath. And we are close. And we are close. Okay? And there are other variables that seem to be important. This may be our true social determinants of health, because we have used health as the dependent variable, not disease. It's a sense of belonging in our local community. Seems to be very important. Our relationship status. Okay? Single people seem to be happier and healthier. Okay? And widowed people and divorced or separated are at the bottom, but there may be confounding factors in terms of age and other things there. But single people seem to be number one, by the way. So think twice about marriage. Of course, people who are employed tend to feel healthier than those who are not. Those who are satisfied with their lives, okay? Those who feel food secure, they have enough food, they are not going to be missing. And by the way, 1.2 million people in Toronto alone are missing meals because of money issues. Okay? I don't know exactly the figures in Ontario in general, but the numbers seem to be increasing. Stress levels, especially at work. Educational levels. People with post-secondary education in general feel healthier than those who don't have post-secondary education. The question is why? Is there a confounding factor with many other things? That's what we are going to be trying to reveal very soon. But any of you interested in joining efforts to analyze this incredibly rich data set, please let us know. We have no grants for this. Okay? We are doing it on a voluntary basis with people in Spain, in Argentina, in Colombia, in the US. We need more supporters in Ontario to be looking at this data set and see if we can come up with fresh insights about social determinants of health. When we look at the Canadian data set in general, the picture is even better, slightly. May not be statistically significantly better, but in absolute terms, okay, we seem to be closer. 11.6% of people said that their health was poor or fair. 12 years of age or older. Reached by telephone, by a computer. What would take us to get at least this cohort to feel 100% health? And how about that, a contribution from us? We'll stop complaining about why public health is not perceived as important. Because if we keep the focus on disease, we are doomed. We cannot beat the clinicians, the merchants of immortality. Okay. And by the way, how much time do I have? Is it until 10 or 10:15? There are two versions of the program. Until 10? Okay. So I'm going to press the accelerator. Are you enjoying this? Are you finding it useful? Thank you. Thank you. Straight from the heart. Okay, so now, how healthy are we humans? Well, we have had data for a long time. The WHO, the World Health Organization, had a survey 2002, 2004. Guess what? We didn't analyze data across countries. So we did. We got the data set, again, volunteers doing this. We have data from 271,000 people in 69 countries. Most people, 62%, reported their health as good or better. So this is on its way to a pandemic. The best predictor for bad health, to be a woman. This is why I was so excited when we saw the almost identical figures for men and women in Ontario. Why? What lessons can we draw from Ontario for the world? Yeah. When are we going to celebrate that? Then we went ahead, and with this group of volunteers, again from many other countries, we went ahead and looked for data sets at the national level on self-reported health. Now we have data from 613,000 people in 116 countries. We are trying to figure out how valid these data are. Now we are looking at 40 national indicators, GDP, literacy levels, you name it, to try to explore what might be true determinants of health. And guess what? Boom, 70% of people report their health to be good, very good, or excellent from this data set. The best predictor for bad health, again, to be a woman. And opportunities galore. There are no national data on children below the age of 12. What are we waiting for? How do we assess health in a 4-year-old, in a 5-year-old? Should we use happy faces? Who knows? Great opportunities. We are neglecting our kids again. Okay? But at 10, I could tell you how healthy I feel. I'm probably at 7. I'm probably at 5. We don't know what's the earliest age. We could be a leading region in the world in terms of understanding how healthy our children perceive themselves to be. There are no longitudinal studies. So we keep sampling different groups of people. What if we had one group of people that we could follow in time? So we are trying to design what we call the Healthy Humanity Study. Get a cohort of humans and invite them to join forces with us from all over the world to have a conversation about how we as a species feel. It would be wonderful to do it together and to use Ontario as our epicenter for that. We don't have girl power. We may have more than we think. At least at home, I can tell you, there is a lot of girl power there, women power. Even the word girl is problematic there. Okay? So, I have relatively little time. I have a lot of things to show you, so I'm going to really press the accelerator here because there are other issues to consider. One, we need to include a lot of people we have been excluding. What's happening with our homeless? What's happening with people who don't have landlines? What's happening with those who are at institutions? Okay. How could we prepare for what seems to be almost inevitable, that computers are going to replace more and more of us? And it's happening more and more and more. What are the public health implications of these trends? And those people with repetitive or predictable jobs are disappearing. They are being sent to the unemployed side, and we know that that's a determinant of health. And look at this kind of piece. Okay? And we are abusing them now. Wait until this robot gets mad and has a machine gun. Okay? This is robot abuse, but it's just to test how resilient, because there is so much abuse in the workplace that we need to ensure that the robots can tolerate abuse as well. And look at this. Okay. This is owned by Google. Look at this. Look at this. autonomous. Okay? Okay? This is happening, and at a very fast pace, because employers don't like people unless they buy their stuff. The biggest problem for a CEO of an organization is the workers. They go maternity leave, they unionize, they complain, they're not reliable, they get tired, they get sick. So if there are machines to replace us, we use machines to replace us. And it's happening in hospitals now.
Now you've heard of tug
this
boats.
Is coming from the defense
introduce
industry.
you to the tug bots.
Press go to continue.
25 of them roaming up and down the hospital
So to
halls,
make more money,
ferrying meals,
these defense
trash,
contractors
and even pharmaceutical
decided to use their
supplies.
technology
The latter
and
being
offer it to
securely
hospitals.
locked in,
And
so
look
when
at
they
this.
arrive at their destination, only people
These
with the
things
PIN
don't
code or
collide,
fingerprint
they call the
authentication can
elevators,
open them up.
they deliver things, they
With the
don't
equivalent
complain,
of
they
14
don't unionize, they
football fields
don't
to
go
navigate,
maternity
they
leave,
rely heavily on
they don't
built-in
have
maps
sick
and
leave,
sensors, together with Wi-Fi, to get their bearings.
Yeah?
This robot has just summoned the elevator remotely, and now, after making sure that there's no one in it, he, she, it is going to take the supplies up where they need to go.
Okay.
Hold that lift!
Hold on, they're not going to wait for us. Okay? So they're not going to wait for us. And this is what's happening to all of us who do things that computers cannot do yet. We have been dehumanized. Oh, we need so many public health analysts. Okay, how many and by when? That's it. Yeah. And this is having huge implications now in terms of public health. The main cause of disability in the world, depression, associated with work-related issues. What are we doing about it? I'm going now to finish very quickly. I have an electrode implanted on a very private place that if I probably take one more minute, I will get an electric shock. And so Google is investing a lot of money in this, IBM too, to replace those jobs that are not predictable, that are not repetitive, our jobs. And they just beat the world champion at Go, the most complex game in the world. And this game needs intuition. So now there are machines with intuition. Imagine that coupled with that robot. Game over for us. So now, really very quickly, a couple of elephants that remain unacknowledged in most of our rooms. We are now in trouble. We are broke. We are almost facing the cliff of economic collapse. This red is our deficit, our debt. We are the world's most indebted region. We are the world champions in terms of debt. What are the implications of this? We are too reliant on electricity. In the middle of the winter, the power goes off with no hope to return. We die. We have forgotten how to feed ourselves, how to support each other and all that. These are big public health issues that we could be paying attention to in addition to all the others. And we keep our attentions with the clinical side, okay? How could we engage this disease industrial complex in a conversation about the pandemic of health, in enabling 100% of the community to feel healthy, and if they don't contribute, to call them off for what they are? How could we become more relevant to the public? This report almost completely ignores public health. Almost completely. It's as if we didn't exist. Apart from vaccinations and some preventive stuff of diseases, public health is not there. And we all know it. But it's to a large extent our fault. We need to communicate with the public. We need to use the ecosystem. How can we use all these tools to engage the public and to engage ourselves as members of the public so we can achieve a healthy life, all of us? How could we stop our obsession with trying to predict the future and complemented it with efforts to try to create it from Ontario and start completing sentences like this? Ontario, the first region in the world where everybody's healthy. How about that? Let's do it. Why not? If we had one wish, what would it be? That would be my wish. Okay? That we become the first region in the world showing that everybody could be healthy. And then to this little terror, Gabriela, we could say, we are going to offer you something different. We are going to offer you a system that promotes the promotable, that prevents the preventable, that cures the curable. There is a role for curative stuff, that relieves the relievable, that controls the controllable, that transcends with you the inevitable, and that always, always, always is with you. You will never, ever be alone, because you are part of a big we. We, together, will ensure that each of us would enjoy the healthiest possible life until our last breath. If we can say that to the next generation, we would have fulfilled the dream of public health, and hopefully would have no more conventions like this. Thank you very much.